For my Sportsman 3 injury prevention project, I worked on ankle stability training. For my project, I worked with 3 clients. There are multiple reasons for this. One being my project would apply to multiple people, including athletes and patients who aren't involved in any sports but want to avoid an ankle sprain. Additionally, having multiple types of clients will increase the reliability of my data to apply to a larger audience. My first client is Mackenzie Ekman. She is not involved in any sports and hasn't experienced any sort of ankle sprain or injury. Mackenzie is a 16-year-old junior. I'm using her as a baseline for people who are looking to build ankle strength but don't have any participation experience in extracurricular sport involvement. My second client is Gabby Dermine. She is a 16-year-old junior who is involved in track. Additionally, Gabby is involved in weightlifting classes. She has not experienced an injury to her ankles. I will be using Gabby as a baseline for people who are involved in sports and have not experienced an ankle sprain and are looking toward preventing ankle injuries. My third client is Rocky Petrolingo. She is involved in multiple sports, including tennis, basketball, rock climbing, and lastly, track. Rocky previously experienced an invertical grade 2 ankle sprain. I will be using Rocky as a baseline for people who have previously experienced an ankle sprain and are looking to return to play or prevent further injuries. Ankle sprains are a result of the ligaments that stabilize the ankle being stretched or torn, such as ATFL, CFL, and lastly, the PTFL. These 3 ligaments are the lateral ligaments mainly supporting the outer ankle. There is also the deltoid ligament, which supports the inner ankle. There are additional ligaments, however, these will be the ones my project focuses on. There are 3 different categories of ankle sprains, grade 1, 2, and 3, with grade 3 sprains being most severe, possibly resulting in surgery. Grade 1 ankle sprains mainly consist of stretches to the ligaments. As a result of this, mild pain, tenderness, and stiffness are likely experienced. As a result of this, the ankle will remain stable, with weight-bearing activities such as walking are usually possible with minimal pain. Grade 2 ankle sprains are results of partial tears to the ligament. As a result, moderate pain, swelling, and bruising and tenderness of the area are experienced. The ankle may feel somewhat stable, however, walking is painful and stability could be compromised. Grade 3 ankle sprains are a result of a complete rupture or tear of the ligament. As a result, severe pain, swelling, as well as bruising occurs. When injury occurs, a popping sensation is possible at time of injury. As a result, the ankle is unstable and may give out, making walking not possible. Here is a visual representation of each grade of ankle sprain. Some causes of ankle sprains may include uneven surfaces, landing incorrectly after walking, jumping, or even running, incorrectly fitting shoes, and lastly, walking or running with weak ankle strength, which is what my program is going to be focusing on. As a result of ankle sprains, some immediate results may include pain, swelling, and bruising as a result of a ligament being torn or stretched, loss of function as far as for movement, strength, stability of the ankle, as well as making it harder to bear weight. Tendons may be affected with pain, inflammation, and even being damaged or ruptured. Nerves in the ankle can additionally be altered. Due to this, tingling may occur or numbness and burning sensations. In the long run, things like weakness and instability can occur if ligaments heal incorrectly or if ligaments are permanently stretched. Chronic pain may also be present if there is an altered gait resulting in straining other areas like the hips and lower back. Due to this, balance issues may occur, leading to weaker reflexes and less coordinated movements. As a result, impaired mobility may also occur as stiffness and swelling can persist, affecting range of motion. As a result of these long-term effects, returning to sports may be affected. Ankle sprains are most common in athletes, especially in athletes involved in sports which jumping and quick changes in direction occur, such as basketball, soccer, and volleyball, as tripping or landing awkwardly may result in injury. Lastly, athletes are more susceptible as a result of poor warming up or previous strains and incorrect footwear. There are many options for recovery when it comes to ankle sprains, including PRICE, standing for protection, rest, ice, compression, and elevation, immobilization using crutches or boots, physical therapy or bracing. Taping is another common tactic used for treatment and prevention in a recurring sprain. Lastly, in extreme cases, surgery is used but typically only used in severe cases. Before going into the workout, I made sure to look at each client's history and see if any of them have experienced any significant ankle injuries. In order to know if there is any important notes or change I should make to the workout program for that individual, additionally, if there are any points that I should focus on. Mackenzie doesn't have any experience with strengthening the ankle and hasn't had any injuries. Gabby is involved in strengthening, though not focusing on the ankle. Lastly, she has not had any experience with any previous ankle sprains. Rocky has the most experience with ankle strengthening as a result of her previous ankle sprain, where she had to do physical therapy for about 3 to 4 weeks, where she reached a point that she wouldn't require the strengthening exercises given to her. With Rocky's history, she wasn't able to be involved in weight-bearing activities, including walking, for about 3 days. Our goals for this program are to reduce the likelihood of a recurring ankle sprain and build strength of the ankle, increasing the performance and confidence of my clients and other athletes using my program. I used 4 baseline tests to receive data on my patients in different categories, including strength, balance, and lastly, endurance. The first test my clients attempted was single leg balance tests, where they were instructed to balance on one leg with their eyes closed for the next 30 seconds. I counted each time they had to correct their balance. My second test is called X jumps. This test required me to make an X shape out of tape on the ground. My clients were then instructed to jump forward, back to the center, to the right, then continuing this pattern in a clockwise direction. You can see this being shown in the video above. They were instructed to continue this exercise for 30 seconds on each foot. My third test was a reactive balance test. My client was instructed to stand on one leg while tossing a ball back and forth, forcing them to focus on catching and tossing a ball while balancing. This exercise was done for 30 seconds on each leg. My last test was a calf endurance test, where my clients were given 1 minute to perform calf raises by slowly raising to the top of their toes, then slowly lowering back down. For my workout, I made sure to use Rocky's previously workout from PT Revolution to build my own workout plan. This not only utilized my sources, but was based off a professional program for building ankle strength. First, my clients were instructed to flex their feet for 5 seconds in 4 different positions, repeating this 3 times. These 4 positions would target dorsiflexion, plantar flexion, internal flexion, and external flexion. For their second exercise, my clients were instructed to perform bells and skiers. This utilizes plyometrics to build strength. For the first half of this exercise, my clients were instructed to jump left to right. Each time landing on one side would count as 1 rep. The second half of this exercise is the same thing, but instead of jumping left to right, my clients were instructed to jump forward and backwards. Each part of this exercise were put together and performed a total of 3 times. The third exercise I called tracing. My client was instructed to sit with their legs extended and imagine their big toe as a pencil, then trace the letters of the alphabet out. This exercise was done on each foot 3 times. The next 2 exercises were calf raises, starting with 2-legged raises, doing 30 reps, then moving to single-leg calf raises and doing 15 reps. Both exercises were done a total of 3 times. Lastly, my clients did complain about cramping. To limit this and help them with this, I implemented a stretching exercise. They were instructed to have their ankle at 90 degrees and put their foot about 4 inches up a wall, then push their hips towards the wall. During the workout and initial baseline tests, it was reported my clients were experiencing cramping. Then, after their workouts, they would experience light soreness the next day. Apart from these factors, they had no trouble completing their workouts. For my data, I used calf raises as I had the most data, which was certain and more reliable, and I wasn't entirely certain on the other data received. As you can see from the data chart, Mackenzie improved about 46% on 2-leg calf raises, 56% on her right leg calf raises, and about 24% on her left calf raises. Gabby improved about 18% on 2-legged calf raises, 14% on the right calf raises, and 25% on left calf raises. Rocky improved about 20% on 2-legged calf raises, 15% on right-legged calf raises, and 9% on left calf raises. As a result of my program, you can see it is successful as all patients improved in each section of calf raises. Thank you for watching my Sportsmed 3 ankle injury prevention project.